Asthma remains a global major challenge for public health, affecting more than 272 million people of all ages. That's 4.5% of adults. That's between age brackets of 18 to 50. It is one of the most common chronic disorders worldwide. Asthma severity and asthma control are separate yet interlinked domains in all patients. Now, this is generating concerns that coronavirus disease, that's COVID-19, caused by severe acute respiratory syndrome, can be complicating asthma cases also. The World Health Organization, WHO, recognizes that asthma is one of major public health importance. The questions are, how possible is it to manage asthma? How can it be reduced or prevented? And the attack, that's also called episodes or exacerbation, how can they be managed? Well, this year the focus is on uncovering asthma misconceptions. This provides a call for action to address the widely held myths and misconceptions concerning asthma. Some of these misconceptions are: asthma is a childhood disease. That's what so many people have been talking about. Individuals will outgrow it as well. They believe it as well. And asthma is infectious. Asthma sufferers should not exercise. These questions are becoming so many. But trust me, on this program, we're going to find answers to all of these questions. Now, asthma is only controllable with high-dose steroids. So welcome to Nigeria today. Muspadam Wahab is my name, and I have a guest in the house that's going to provide answers around these questions that we have on Nigeria today. Welcome. Joining me for more insights is Dr. Dorcas Obidia Okoro, Senior Registrar, Respiratory Units, National Hospital. Welcome to Nigeria today, madam.
Good evening, Nigerians. Thank you so much for having me in the studio.
It's very good to have you around, madam. Now we have a very topical issue at hand. And let's begin with your take on the general asthma burden in Nigeria. How disturbing is it at the moment?
Okay, generally, asthma globally accounts for greater than 268 million cases. Okay, within Nigeria, we have a lot of asthma cases, and the burden is really high and alarming, especially within the pediatric age group, and we could also see this, in among our adults in respiratory medicine. So the burden is quite alarming. So it calls for, for we the physician to be proactive, especially about the diagnosis, because many people go on with their asthma without knowing they're actually asthmatic, and many people out there to make the diagnosis by themselves and start receiving treatment even without the help of a clinician evaluating them properly, making the burden higher than what is supposed to be, especially in Nigeria.
Thank you very much for that opening. And now, you heard me when I was talking about all the misconceptions around asthma across this country particularly. Now, we'd like to hear from you. Is asthma hereditary?
Asthma is hereditary. Asthma could also be seen as a group of heterogeneous disease, and part of the group is hereditary disease, because one of the risk factors for asthma is atopy, which is a predisposition, genetic predisposition of a person having asthma. So it could be hereditary. It could be hereditary. Although there are some patients that could have adult onset asthma, okay, maybe due to occupational exposure and so on. But generally, it is seen because atopy accounts for greater than 70% cases of asthma. So largely, it is seen as a hereditary disease.
Okay, how does one know when it's asthmatic, or what are the early signs that you get to see to give you a hint about whether being asthmatic or not?
Yeah, asthma, as we all know, is a chronic inflammatory airway disease that is characterized by some respiratory symptoms such as cough, wheeze, shortness of breath, and difficulty in breathing, as well as chest tightness. So if a patient presents with these symptoms, it's also said that these symptoms are variable in time and intensity, meaning that the symptoms has a pattern. It's not just like every other respiratory tract infection that doesn't have a pattern in the sense that these symptoms of cough, wheeze, difficulty in breathing, or chest tightness, it could be episodic. It could have diurnal variation, meaning some patients may have worsening symptoms in the morning. Some will tell you that their symptoms are worse at night, and the time varies and the intensity of the symptoms varies. It could be seasonal. So when you see a patient presenting with all these symptoms that seem to be seasonal, that have diurnal variation, that looks episodic, it will now raise your suspicion that possibly this patient is having asthma. That is on presentation of the patient.
Okay, what are the best ways to manage these at the early stage? Because you have talked about some of the signs, the cough and all of that, and you have to make your choice of environments where you expose yourself to. How do you manage it at the early stage? Okay,
before even making the management, before even stepping into the management of asthma, apart from the patient presenting with the symptoms that seem to be seasonal, you still have to step up to confirm this diagnosis. You step it up by conducting a spirometry test for the patient, which in asthma, in cases of asthma, it will show an obstructive pattern. Okay. Aside from that, you may also do some blood tests and other tests just to confirm your diagnosis. Having confirmed the diagnosis, the medication of asthma is divided into two. We have the reliever medication and the controller medication. Many times in asthma, patients present with attacks. They call it exacerbation. So you need a reliever medication to stop that attack, to reduce the symptom. Before GINA, there's something called Global Initiative of Asthma. Okay, they came up with a suggestion stopping a short-acting bronchodilator that it was initially used for the treatment for reliever medication. Reliever means stopping the attack. Controller medication is maintaining the patient from entering into exacerbation. So before now, a short-acting bronchodilator was used. So GINA has stopped the use of short-acting bronchodilator as a monotherapy. So for issues of early asthma, so what is being recommended now by GINA is the use of low inhaled corticosteroid therapy. You can use it. Corticosteroid therapy is like steroid. Okay. It is an inhalational form of steroid. I was
going to ask you for the meaning.
Inhalational form of steroid. We have it in form of budesonide, but commonly it comes in combination with a long-acting bronchodilator. Example, there is Symbicort. It's everywhere. But I advise nobody should go and get this medication, taken without a proper evaluation by a doctor to really confirm the diagnosis of asthma in the patient. Then aside from this reliever medication, we also have the controller medication where patient can as well use the inhaled corticosteroid therapy as well as leukotriene's receptor inhibitors. There are other adult drugs which could be used to control this attack or exacerbation. So aside from the ones I've mentioned, you can also use macrolide, which we have azithromycin. You can also use, depending on the presentation of the patient, you can even go as far as using theophylline, to stop the attack in the patient.
Thank you very much, Dr. Okoro. Now, it is a respiratory disease, disorder that we are talking about here. Do people really need to avoid those who are asthmatic? Is it infectious or contagious?
No. Asthma disease is a non-communicable disease. Right. It's a chronic non-communicable disease. You don't need to avoid them. It's not contagious. So it's not like every other infectious disease. It is non-communicable, meaning it cannot pass from one person to the other.
All right. Now you've talked about the drugs and some of the ways to avoid or to prevent this disorder. What are the environmental factors that can trigger asthma attack?
Sorry. So we have a lot of triggers in asthma. At my introductory part, I forgot to tell you that these symptoms can only happen when a patient is exposed to triggers. And the triggers include, number one, we have some viral infection, viral respiratory infection caused by rhinovirus C. We also have atopy, which is a genetic predisposition of patient having asthma. We have exposure to pollen grains, smoke, cigarette smoking, even smoke from biomass, that is cooking with firewood. We have exposure to perfume. Some people react to perfume, some people react to pets, dog feathers, cat furs, and so on. Some people even exercise may trigger, asthma in some group of patients. Also drugs like pain relief, NSAIDs, we have beta blockers, cocaine, heroines. Many patients react to it and they have this asthmatic attack. And it's also said that damp, moldy walls or damp, moldy rooms can predispose a patient to having asthmatic attack, and so on. Even food, some food are implicated, like some fish, milk. They say pig milk is also cow milk is implicated. Okay, we also have shrimps, lobsters. Some patients react to all this. So it's not just environmental factors. We have food that could be implicated, and we also have drugs, exercise, and so on.
Thank you very much, Dr. Okoro. We still have a lot of issues to raise around this and find some answers to them. But let's quickly take a break and hear from people on the streets of Abuja to gauge their knowledge of asthma.
Well, asthma is a respiratory condition that causes shortness of breath with certain people. I wouldn't say I know the causes per se, but on a day like World Asthma Day, I feel like there should be more sensitization about the subject. A lot of people should know what it is and how to respond if someone around them has an asthma attack.
According to me, I believe or I feel asthmatic patients are people who lose their breath for a short period of time due to inhaling of dust. So I feel that if you know you are asthmatic, please always try to prevent dusty environments and always go out with your inhaler to prevent any emergency situations, and please see your doctor on time.
About the weather is very cold. They should ensure that they cover themselves up. Always put on cardigan, pullovers and the rest, and stay off AC.
I heard of a guy that was asthmatic. He just slumped and died. I was told that he was not with his inhaler, something like that. And people that were around him by that time, maybe he was trying to signal to them and nobody was, able to rescue him. Maybe the body signal, maybe they don't get what he was saying.
Being an asthmatic patient is not the end of the world.
Indeed, being an asthmatic patient is not the end of the world. That's coming from one of the respondents there. Welcome back. Still Nigeria Today on NTA News 24, and I still have my guest, Dr. Dorcas Obidia Okoro, Senior Registrar, Respiratory Unit, National Hospital, is still here with me in the studio talking about this. The lady in that actually painted a picture, a very terrible picture there about a patient who died because of how people deserted him or her during that attack. How do you respond to this?
Okay, in asthma could be fatal sometimes, because what happens is that when the attack starts, there is bronchospasm and there is narrowing of the airway. The patient cannot breathe in enough air, and when the patient cannot breathe in enough air, there is problem with ventilation, leading to reduced supply of oxygen in the patient's blood. So I really feel for the patient. Possibly patient had the attack, had hypoxemia, and all the symptoms and all that. So I believe if somebody was there to quickly give the patient the inhaler, you know, in the inhaler, in whatever form, you know, the patient couldn't have died, because just taking in of inhaling the substance within the inhaler would have helped to dilate the airway, as in the airway that was once narrowed, it will become dilated, and enough air could have entered into the patient, and that could have prevented the death of the patient. So it's like a very big lesson to all of us. If you see any asthmatic patient, or patient, you know, you feel, oh, this could be an asthmatic attack, so what you have to do is to just help the patient immediately, not to overcrowd, you know, the patient, reducing oxygen supply further for the patient. If you can't get an inhaler anywhere, you just have to take this patient straight to an emergency A&E, to any nearby hospital. It's just to give an inhaler and the patient will leave.
Okay, the inhaler apparently is the only solution, the immediate first aid to be given to such a person.
Yes, yes. Inhaler is the only first aid medication that could be given to the patient. In the absence of inhaler, there are other injections like an IV aminophylline. Okay, if inhaler is not available in that particular place, you can take the patient to any good pharmacy where there is aminophylline injection. You know, giving the patient that injection will help the patient to survive. Okay, then apart from that, oxygen, you can also give but all this could be done in the hospital. Supplemental oxygen, you know, just to help the patient, to improve the oxygenation within the patient, you know, and others. But all the same inhalers, you know, the inhaler, especially the one that contains the corticosteroid, you know, is the first and is the best to be given to patients.
Well, then it falls back to the fact that patients, an asthmatic patients should always have some people around, right?
Yes. An asthmatic patient, understanding his condition, should always be with his inhaler. First of all, inhaler should be everywhere, should be around you, in the car, in your purse, wherever you go to. You know, you can't say, okay, people around you, you know, that cannot be possible, because sometimes you may be without people, but many times it's better for people to be around you. But always have your inhaler around, so that when the attack comes, you can use it to save yourself.
Okay, some of the misconceptions that we talked about earlier is that asthma progresses from mild to a severe one. Why is it like that, or what are the factors that could be responsible for this progression?
Yeah. Asthma can progress from mild to severe one, and asthma may just stop at mild, from mild to moderate, without the progression to severe one. Different people present with different forms of asthma. That is very important to note. Then for the progression of mild to severe ones, yes, it's very possible. This is because, first of all, the patient has not recognized his trigger, so is consistently exposed to this trigger, making him or her to have chronic airway inflammation. And when there is chronic airway inflammation, the process progresses. And what happens in asthma? Just imagine the airway like a pipe, you know, undergoing inflammation. Inflammation is like an injury happening, something getting swollen. When it gets swollen, the space is narrowed, you know. So if you are constantly exposed to a trigger is what causes the attack. Do you understand? So it causes this chronic inflammation. Before you know it, there is hypertrophy of the airway, there is hyperresponsiveness of the airway, and what was like a mild to moderate asthma will eventually lead to a severe asthma. That's number one. That is constantly being exposed to the trigger, or not recognizing his or her trigger. Another thing is constant respiratory tract infection. There are some people that are prone to respiratory tract infection which are not well treated. So when you have this respiratory tract infection, you are constantly, you know, entering into, because respiratory tract infection leads to exacerbation. So if it is not well treated, you know, with the correct antibiotics, that mild to moderate asthma will eventually lead to severe asthma. Another thing is asthma phenotype. There's something that It's called asthma phenotype. So if you have the allergic form of asthma, it's always very difficult to treat. They call it the eosinophilic asthma. So it's very likely the patient may progress from a mild form of asthma to a severe form of asthma, and other comorbidities that may be associated with the patient that is having the asthma. Comorbidities, I mean other ailments like chronic ailments, diabetes, hypertension, and so on. Smoking is another thing that can make your asthma to progress, because cigarette smoking damages the airway more. So you can imagine airway that is already hyper responsive, that is already highly inflamed, being exposed to cigarette smoke. So it will now convert the mild form of the asthma to severe form of the asthma.
Does that also include the passive smokers?
Yes, it includes passive smokers.
Right. One of the respondents on the streets actually gave an encouraging word there that being asthmatic is not the end of the word. What would be your encouraging word to those who are asthmatic today?
Yeah, being asthmatic is not the end of the world, in the sense that I've seen so many patients, that presented with asthma. With time, they outgrow the symptoms. Although asthma is known to be a chronic inflammatory disease, it doesn't have cure, in quote. But there are many patients that have outgrown their symptoms, so they live as if they have been cured. So when you have asthma, what I advise is that don't be depressed, don't feel bad. First of all, recognize your triggers. As long as you know your triggers, you can stay without this attack for a very long time. You can even stay without attack, like forever, as if you've been cured. So know your attack and your triggers, and stay away from the triggers, and always follow up with your consultation. Make sure your inhalers are available. I am sure with this, you can live the normal life. It doesn't affect anything. So being an asthmatic is not the end of the world. You may be lucky to outgrow it. You may be lucky to stay with minimal or no symptoms, as long as you do what is expected of you to do.
All right, stay away from your triggers once you know them. That's encouraging enough from Dr. Okoro. That's how we end the program tonight on Nigeria Today. But we must say thank you to Dr. Dorcas Obidia Okoro, Senior Registrar, Respiratory Unit, National Hospital, Abuja. We really appreciate your time.
Thank you, sir. Thank you for having me around. I really appreciate it.
It's our pleasure. We want to say thank you to you too for being part of the program tonight. Nigeria Today will return tomorrow at 7:30 p.m. And you can always watch this edition and other ones on YouTube. That's www.youtube.com/NTA News 24 Hub. I am Musbad and Wahab. Continue to stay well.